My name is Saiken MD, and I'm a Dr. VTuber and internal medicine doctor in real life. Heart attack versus cardiac arrest. Do you know the difference? Though the words might sound like they mean the same thing, and the former can actually cause the latter, these are actually two separate medical emergencies that require two separate treatments. Heart attack is also known as a myocardial infarction, which is actually more descriptive of the process. In a heart attack, a person classically experiences severe chest pain as a result of reduced blood flow to the heart muscle, causing death of myocardial tissue. One of the most common causes for a heart attack is the rupture of a fatty plaque inside your blood vessels, which then breaks off and lodges inside a coronary artery, preventing blood flow. When someone presents to the hospital with the telltale signs and EKG changes from a myocardial infarction like this, we can activate a code STEMI. This pings the team with the interventional cardiologist to set up the cardiac catheterization lab and perform a cardiac cath. Here, the cardiologist will navigate a thin tube through your vessels to look for any blockages and balloon them open in order to restore blood flow to the heart. On the other hand, a cardiac arrest is when someone's heart stops beating entirely. This is disastrous because if the heart stops pumping, then it's not getting oxygenated blood to any of the vital organs, most importantly the brain. Anytime a person's brain is not getting blood flow, like in a stroke or a cardiac arrest, timely intervention needs to be done in order to preserve functional brain tissue. Once the heart stops beating, a person is considered technically dead, so all efforts must be made to resuscitate. Once it's confirmed that the patient does not have a pulse, then the number one most important thing to do is to start CPR. In the field with EMS present, or if this happens in the hospital, we would next follow the ACLS algorithm to deliver a combination of CPR, electrical shocks, and medications in order to get the heart beating and bring the patient back from the dead. There are a lot more nuances to CPR, BLS, and ACLS, but these are just the basics. If you want to learn more, or if you're interested in pre-med or going to medical school to become a doctor, follow me on Twitch and X at SaikenMD.